Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader of regenerative therapies. Today we're discussing how to get back pain resolution with stem cell therapy at our Philippines clinic. All right, so when we're talking about back pain, I have some visual aids today. For 85% of individuals around the world will develop back pain at some point in life. And for an unfortunate few, it becomes chronic. Some patients end up having surgery, others end up trying to deal with it with opiates and other medications, physical therapy and what have you. It can really be a downer, waking up every day, having to think about the pain, having to manage your life around it by not doing certain recreational activities. Maybe you haven't been able to work as a result of the back pain. So let's look at this model of the spine. I'll show you how we treat back pain with regenerative biologics to give the vast majority of patients we treat resolution of their pain and the ability to avoid potentially risky surgery or the need for opioid medications. All right? So, patients who come to us, and I'm going to show you from the back of the spine, all right, with back pain, either have usually arthritis of these thumbnail-sized joints in the back of the spine, they're on either side, called the facet joints, and possibly pain emanating from the joints that go between the sacrum and the pelvis, the ilium, the sacroiliac joints, all right? There's one on this side, and there's another one, jagged one, on this side, okay? So, you can't ignore the SI joints because a fourth of back pain emanates usually from the SI joints. All right, so it's often a combination. If you have arthritis in one facet joint, what are the chances you have it in multiple? Very, very high. So about 5 years ago, we developed our lumbar protocol, which uses our proprietary regenerative trifecta of biologics. Now, that's our trademark term that involves a combination of three things. One is mesenchymal stem cells that are derived from umbilical cord tissue. All right? That helps to regenerate and restore cartilage to the facet joints and other damaged tissue. We also offer stem cell exosomes with the mesenchymal stem cells to help reduce inflammation and reduce pain as well. All right? The third part of the trifecta is what's called PRP, and that's platelet-rich plasma therapy involving a simple blood draw from you that when spun, it concentrates the growth factors and it helps offer a structural matrix, a scaffolding to help build new tissue in and around these painful joints. So most pain doctors, orthopedic doctors around the world will say to you, you know what, it looks like a couple of these joints are arthritic, so I'm going to inject these two joints or this one joint or whatnot. That's ridiculous because, as I just said, most of the time you have multiple joints that are painful. So what we do is we flood the low back with the regenerative trifecta, including multiple facet joints, the areas around those joints, the paraspinal muscles, also into the SI joints if it's necessary. Also, if you have a sciatica component, pain that goes down the legs, we will also do an epidural injection too. Now here's what we do not do. We don't inject directly into these intervertebral discs, okay? Why? We used to do that. For one thing, it's incredibly painful. Patients have a very hard time getting off the procedure table, and the pain lasts for days. It's almost incapacitating, all right? The bigger problem is that when you inject these regenerative biologics into these degenerative discs, okay? Why? We used to do that. For one thing, it's incredibly painful. Patients have a very hard time getting off the procedure table, and the pain lasts for days. It's almost incapacitating, all right? The bigger problem is that when you inject these regenerative biologics into these degenerative discs, it does not restore the disc height. If it's degenerative like a pancake, it's not going to give you back that height. It's not going to reinflate the tire, all right? There's also some evidence showcasing that if you penetrate the disc, say with a needle, and put in a bunch of fluid, it may down the road cause more damage than it does benefit. So we stopped doing the disc injections years ago because we got better results using the Regenerative Trifecta with the lumbar protocol that we developed. I can't tell you how many patients we've had who've avoided the need for surgery successfully, gotten a lot of pain relief after having what's called failed back syndrome. They had back surgery, it didn't work, and they didn't want to have more surgery, or they weren't a candidate for more surgery, right? So we can get you a lot of pain relief for a long period of time so that when you wake up, for example, you don't immediately think of your pain. Can you imagine waking up, if you've had chronic back pain for years, and getting to a point where it's not the first thing you think about? You're not counting down the minutes until it's time to take your next pain pill? It's a fantastic way to live, and we can help get you there, all right? Visit us online at r3stemcell.com/Philippines. There's a lot of educational information on the website. And then call us at the number on the screen. We'll set you up with a free consultation to see if you're a candidate for our Regenerative Trifecta lumbar procedure. Thanks for watching.